Diabetes is a massive problem all across the world. This could be attributed to the fact that more and more people are obese and overweight. Diabetes has been linked to obesity, and reducing your risk by losing weight is the first step to take. Lots of people who are diabetic do not actually know they are. This is because the symptoms could be misconstrued as another, less serious condition. So could you be diabetic, and do you know what to look for? One type of diabetes is called type 1. This happens when your own body stops being able to produce the amount of insulin it needs to be able to efficiently control your blood sugar levels. The other type of diabetes is called type 2. This is when your body does in fact create insulin, but your body does not use it the way it should. So, with both types of diabetes, your body cannot efficiently use the insulin to control the blood sugar levels in your body. Both of these instances of diabetes will need medication and treatment to help control the condition. Type 1 diabetes requires insulin injections to help keep the production of insulin in control. Type 2 diabetes can, most of the time, be controlled by a good diet and plenty of good exercise. In some cases, sufferers will need to take insulin injections when they have diabetes type 2. There's no anyone who is not able to get diabetes either early on or later on in life. However, some are much more likely to start suffering from diabetes if they're African American, Asian Americans, or Hispanics. It is thought that all people of a Native American history and descent could be much more likely to start suffering from diabetes. If you start to experience any of the following symptoms, it is worthwhile visiting a doctor to have a diabetes test. The test for diabetes is painless and quick, and you'll feel better knowing either way. If you become thirsty and feel thirsty all the time, this could be a sign of diabetes. This could be a sign of type 2 diabetes, and if you're thirsty all the time after drinking quite a lot, visit a doctor. If you suddenly need the toilet all the time for urination, this too could be a sign of diabetes. This could be a sign of diabetes as you're drinking much more than usual because of constantly feeling thirsty. If you start to experience problems in your mouth such as constant bad breath, dry mouth, gum disease, and other mouth problems, could be an indication of diabetes. Having problems with your vision suddenly can also be a sign of diabetes. This is usually a sign of the type 1 diabetes, and you will more than likely require medication.